Monisha, like my team teases me all the time because you're just kind of one of those names that always come up whenever I'm talking to press, right? It's like, oh, Monisha Perkash. I just throw your name out there all the time. And it's because I think it's you do something that's so different than what, Marco and a lot of the other guys are doing in the space. And so I'm glad to finally actually see the whole entire pitch because it's really interesting because it's been forever. So Monisha is the founder of Lumo back. You guys just were introduced to that. To set the stage a little bit more, Marco Della Torre is the former chief science officer, still at Basis. They were acquired by Intel earlier this year, one of the success stories. Also probably the most helpful person, he'll deny it, at New Devices Group. He's great if you have any startups building. Probably the person you want to get to talk to is Marco over everybody else. And Kevin Talbot is principal at Relay Ventures, pure mobile investment company. I know this because I have tried to get him to invest in so many non-mobile things, and he has denied me every time, and so that's my ego talking somewhat. But also, every one of your startups says great things about you and the input that you give. So I'm glad that you're joining us on this. Hopefully we can swing you all the way to Wearables by the end of it.
Wearables are mobile.
Exactly my point. I've got so many companies to show you now. So in this situation, what has been changing in mobile, or what have you guys seen over the last 5, 3, 2 years, 6 months that's been accelerating at least the belief in wearable technology? I'd love to hear the trends that you guys are seeing so that we could understand as an audience if these trends are going to hold true. Anyone want to take a stab at it, Kevin?
Yeah, sure. So we made our first mobile investment back in 2006, and when we launched our 7th fund, we basically ditched everything that we had focused on before, and we said we're going to do mobile only. And if you just think back to what that was like in 2008 versus mobile today, you can see how dramatically the world has changed. Chances are, if you had a mobile device, you had either a feature phone or you had a BlackBerry in 2008, and that was the whole definition of mobile computing. So we were very, very constrained by the types of hardware that we had. So what's happened, what's changed since then has really been driven by what I'll call the world of sensors. The dramatic decrease in the cost of sensors, which has made it possible not only to jam many, many more under the glass in the smartphone that you have today, probably close to 20 sensors under glass today, but also allowed innovators like some of the companies that we've seen today to sort of fragment those sensors out. And the Lumo back's a great example of where you now have much smaller sensors in accessory products that are now communicating with that smartphone. So I think that's what's changed.
And Marco, go ahead and chime in a little bit too. What have you seen as a builder of the products?
Yeah, I think one of the really strong trends I'm seeing right now is the wearables that were built for one single purpose and the wearables that were built for everything, and maybe not any one thing in particular, converging. And I'll give you a couple of examples based on the presentations I saw today. It occurred to me that some of these products would be prime candidates for living on more general purpose wearables. Thibaut, amazing stuff about enabling people. One of the things that occurs to me is that I probably don't want to have to install the app when I'm in a conversation. So if there was a way in which I turned up at any conversation and was getting value in my whole life, and then when I was in a conversation with people who had special needs that enabled, I would already have the app. So for example, I would love to remember all the stupid things I say each day so that I can try and be less stupid each day. Remember all the things that I said to people and who I met. Maybe I install the app because I want to remember what I said. And you get around the privacy issue because I'm really just recording myself. And then, by the way, when I'm in a situation such as the one you describe, I have that functionality that addresses that specific need, and I don't have to go through the process of installing the app. Nor a similar thing, I would love to be able to walk down the street, and if somebody needs medical help, I would love to be a part of administering that. If there's no doctors around, but I can pull up your app and I have a specialist or a doctor who may be even in a different time zone, so they're not in bed, they're awake or they're on call and local. I'd love to be able to provide help even though I'm really just the hands in front of the video camera. You know, and we're starting to see wearables that have audio and video capability so they can record the environment much more directly than a cell phone, which is stuck in our pockets or over in our bags. So this idea that you can provide niche functionality, you know, what Monisha's talking about is addressing one of the top medical issues of our time. But it can be integrated in a form factor that anyone can use throughout their day. It's always providing value, but it has this specific purpose as well.
From the entrepreneur perspective, the trend that I see is this expectation to evolve from being a novelty to a necessity. Gone are the days where tracking for the sake of tracking is fun and there's, you know, a viable market there, and I don't know that there ever was. But as an entrepreneur building a business, that's what I'm finding, you know, in terms of getting traction in any of the channels that we're working. It's, why is this a necessity? What problem is it going to solve? And for whom? And so that's, I think we're seeing more and more of, and that's why you're seeing more sort of vertically specific solutions, because then you can go after solving real specific problems.
Yeah, I think for us, you know, as like an incubator accelerator, which is what Wearable World Labs is, the first thing that we realized was we needed to focus on entrepreneurs who had a specific, you know, niche use case. And out of that specific niche use case, if they had radical fans that bumped to the top of the list, Scully helmets is a prime example of that. One where I was wrong is Jean-Luc, which was one of the companies I was like least accepting of, but it's a rechargeable purse. And as soon as we're done with a conference and she presents, there's a line of executives like putting their emails down so that they could get that purse whenever it comes out. And so like Scully did their Indiegogo campaign, they hit their goal of 250 in 6 minutes. It's because they were nailing the specific use case. And it's almost like setting up a little kingdom. You get it, you solidify the kingdom, and then you branch out in other use cases. It's interesting what you said about the convergence of the bigger platforms, you know, with the niche use cases. That'll be an interesting trend to kind of follow and understand. This panel is a lot about the health and medical side, and I think that you guys all tie into that. And you, Kevin, you have a significant amount of domain expertise with the companies you've invested in. Where do you see, you know, mobile? I don't think that we've done well with mobile in healthcare. I think you know, I can say that in a lot of degrees because there's not a ton of penetration yet. Do you think, one, that is wearables going to jump over and become a significant input into the medical and health community? Is that the jump that's really going to make mobile and healthcare prevalent? And maybe I'm just wrong just about the impact in general, but I'm okay with being wrong. So I'd love to hear you guys' thoughts around how this convergence is happening.
So I'm going to go ahead and disagree with you right away. Just because of the adoption, we're seeing physicians using tablets at an alarming rate for me. Like that technology was adopted so quickly, it's almost as if the apps are now catching up with the needs that physicians have for those platforms. I think certainly when we started Basis, and part of the motivation for having heart rate sensing and physiological sensing was really giving people information about their body that they couldn't get any other way. So I think as we think about wearables and health in particular, we have to think about what wearables can do that the smartphone can't do. I think if you're duplicating things that the smartphone can already do reasonably well, like step counting, for example, you really shouldn't be investing in the hardware that would enable you to just replicate that on the wrist or on the belt buckle. You know, one of the things that Lumo does amazingly well is add this value of understanding your posture and your back pain, your position, and all the ways that interacts with your life, and your smartphone really won't provide that. So finding these areas where the wearable really provides additional value is key. In terms of the sort of interaction with healthcare, I love the idea of democratizing information. So you don't have to go to an ugly guy in a scary white lab coat and give away your life savings just to understand something about yourself. There's plenty of things you can learn about yourself that are actionable for you, and it can be kept private for you or shared as you see fit. And we're starting to get access to those. You know, one of the things that I think Basis did really well early was highlight the importance of heart rate, you know, understanding your cardiovascular system and how that can be something that materially impacts your performance, your stress levels, your understanding of your own fitness, and giving you access to that every day continuously as a part of the product. So really taking the friction out of the system is something that wearables can do a really great job of.
So building onto that, I wholeheartedly agree. I think what's really exciting is the ability to collect data about yourself when you're not in the doctor's office, right? When you're in the doctor's office, they see you at one very specific moment in time. but their ability to be able to see how your data has been trending over time, it's game changing. And then also to look at it from a crowdsourcing standpoint as well, right? We have the ability to now understand how different behaviors impact various health outcomes at an aggregate level. And instead of relying on clinical data based on trials of 10 or 20 or 30 people, we can now amass data from millions of people and get insights into our bodies and into our health that previously was not possible.
So, we have more than 20,000 health-related apps in the app stores. So I think that's very, very exciting. I think that we have some systemic issues to get through with our healthcare system. And so we're, as consumers, we're going to be far ahead of where the medical system is, because it still needs to be consumerized, which means that we have to figure out how to get platform standardization, and all these things will be figured out. But we have to incentivize the practitioners to become service-oriented providers, which today they really aren't. And what will start to drive that is our ability as consumers to have access to all of this data. We're going to demand that. As the shift in who pays for healthcare changes and we pay for more out of our own pocket, then we're going to have much higher expectations. However, the curve that I'll throw at everybody, and this applies to everyone on this stage, and let's leave it that, it applies to everybody here, is that we, the consumers, everybody in this room has to want to do this stuff, has to want to improve their posture, has to want to reduce their weight, has reduce their blood pressure, or get their heart healthy. And I think the reality is that there's a percentage of the population that wants to do that. And with some of the other presentations that we had, there are certainly very niche markets that, because of circumstances, this technology will be game-changing. But when you look at the mass market, we have to want to make those changes, and I'm not convinced that the mass population really wants to make those changes.
I think that's where the design of the product is really important. What we've learned at Lumo is sometimes you have to get people to do the right thing for the wrong reasons, right? And so, for example, with our first product, Lumo Back, we took a very strong focus on back pain, and it was a form factor that looks a lot like a heart rate monitor, but it goes around your waist. It's a high commitment product to wear, right? What we learned is a lot of people who want to improve their posture aren't necessarily motivated by back pain. They may be more motivated by confidence or appearance. And so what we realized is that by taking more of the appearance angle, the confidence, the look and feel your best angle, we've gotten a lot more traction. And so it's an example of designing a product and an experience and getting people to do the right thing for the wrong reasons. And I think, as you add more sort of gamification and social, competitions and tapping into what are the other things that people really care about, and how can you use that as a door to get them to also do the right things?
Yeah, I'll extend that a little bit. I think part of the sort of trend that we're seeing in wearables right now is increasing the number of times in your day where value is added. If your wearable is really just adding value when you sort of wake up in the morning and you see your goals, and then in the evening where you see if you reach them, there's a big part of your day in which it wasn't clear to you what value you were getting from the device, even though the whole time it was measuring everything. This sort of relates to my comment for Thibault. It's like, in his case, there's a specific value proposition when you're in an audience where that technology is helping you engage in conversation. But it's going to be much more valuable if it provides other instances in your day where you get value. Maybe if you're listening for people that are speaking about something, I want to know when I'm walking through the day, if somebody's near me is talking about something in particular, I want that to buzz me. That could really provide value throughout my day, and then if I'm in that context, I get that value as well. And I think healthcare needs to think about its presence in our lives that way. If it's just about healthcare, then you might limit the audience to the people who are actively investing in whatever area you're addressing. But if you start to add in social elements and entertainment and all the other things in our day where we assign value to the features that we're engaging with, then all of a sudden it's not just a healthcare device, it's a lifestyle device. But by the way, it's also making you healthy, and you're engaging with that several times in your day, but there's not big gaps. Those are being addressed by other features in the same platform.
Yeah, I mean, I think for me, because it's just so hard for me to even just find a doctor, right? It's like, how do I find one? How do I get there? I think that, Wearables is a promise where, patients and doctors could have a partnership almost where there is an iPad out and it's, 30% of your patients are in the red because they're super unhealthy. Maybe like 65 are in the yellow, and then these guys are in the green. And then you can reach out and have a queue and focus on like building strong life patterns. I think that's great.
Yeah. But again, you as the healthcare professional have to be incented to have healthy patients as opposed to being paid for treating sick patients, right? So that's what I mean by there has to be a change on the provider side. And clearly there's got to be a change on the consumer side because we've got all the access to this stuff, and it's not very expensive, right? Because what does a Basis watch sell for?
$199.
Yeah, and what does Lumo Lift sell for?
$99.
Yeah, so it's now affordable, and it will get more affordable over time, and so that helps on the consumer side. But we need both pieces to match up.
So do you think this is there just going to be a break of like different types of doctors that focus on different things and like leverage wearable technology, or is this going to be something that can have a large scale systematic change to it for the medical community? I'm really curious because I want it to happen. Like, how do you guys see the possibility of this unfolding? Is it going to be consumer demand? Is it going to be legislation? What's going to save us from this mess?
For me, it's all consumer demand, and that's certainly the way the market's playing this out right now. The way the wearable technology companies are growing right now indicates that this direct access to those insights are actually really valuable already. So I think while the healthcare community in the regulated sense catches up to this and understands how to sort of make sure that the claims that are being made by companies are appropriately regulated, we're already seeing a market here directly for consumers. And that's why things like entertainment and social are emerging, because when you're speaking directly to consumers and you have a value proposition to justify in the $100 or $200 or $300 price range, you're competing with other devices that provide a lot of functionality. If you look at the smartphone as a platform, the tablet as a platform, there's a lot of different ways you can use that in your life. People have that expectation at that price point that this is a device that doesn't just provide one niche functionality, unless that's extremely high value. And that's how you get some products that address niche communities that can have high price points because the pain is so high there to address. But for the general consumer product in Best Buy or Amazon, you really need to be providing functionality that addresses multiple areas of your life to justify that price point. That's exactly why we see this convergence from niche features into general platforms again. Simply at a purchase motivation level, people have to be making that trade-off. I can buy a Chromebook or I can buy a wearable. And how do I justify that decision based on the feature set? Well, it needs to be something that really compares in terms of the number of ways it adds value to my life. And healthcare happens to be something that's so instinctual that it does create that purchase motivation because the benefit is high, but it can't be the only area.
So all right. So I told you I'm really kind of following this vibe for a little bit. So what do you guys think are the necessary steps that we're going to need to see, just in general as like a society to bring about the change? And how does the existing mobile health community, how can they play into this role to kind of accelerate that? I love the whole waving my magic wand and just making things be like I want them to be, because I'm ridiculous and I think that can happen, but like it's not always the case. Like, where do you guys see the acceleration points in the industry, and where can we as a mobile community start to take advantage of some of the early positions? This is probably I think Kevin is probably one of the better equipped to answer that. I know it's a heavy question, man. Take a second to breathe if Marco wants to.
No, I think that it's evolving. Price points are getting to the point where if you need to see a doctor, you can just use Doctor on Demand, and it's not a price point that's going to make you think twice about it, right? So there are those things that are going to start to happen. The whole systematic change has to happen. Accountable care, is going to be the driver for that, so that systematically we see those changes. But I still maintain that a minority of the population will improve their health. They will have all of the data. They will go to the doctor because they actually go to doctors. They'll have an entire year's worth of data, and instead of that doctor taking blood pressure, heart rate, temperature, at that single point in time. They'll have the trend lines, and for a percentage of the population, there'll be a tremendous improvement. Be access to care, it'll be better care, and so forth. Now, maybe that, rolls down the hill and affects people that, don't have access to care. Hopefully that'll be the case, but I still maintain that you have to want this, and I think the vast majority of the population still doesn't. Just look at obesity rates. There are lots of tools out there to help us be more informed about what we're eating, to track our calorie intake, to encourage us to be active, but we still have an obesity epidemic. Right.
I think in reality, you're talking about a health phenomenon that takes many years to reverse. I mean, I think the expectation that the current wave of wearable technology companies should have already impacted that global phenomenon might be a little out of line, but I think that the spirit is right in the sense that if we need to be doing things that change global phenomenons of health. If we're doing things that only address niche concerns, then obviously the opportunity is not as large. I think in terms of what I've seen here today, I would love to see technologies like the ones we saw presented by these amazing young companies get integrated into the primary social experiences that we engage with today. I'd love to see Facebook Messenger supporting applications where you can record conversations in less able communities so that it's already integrated into things that we're all carrying around. My example of having a first-party experience for somebody who isn't in that community so that when I am engaging with that community, I already have it. I'd love to see that become a focus for the major social players in the industry today.
So one of the things that I really like and that I'm really encouraged about is wearables for children, right? And it's, when you look at every generation, I think the one today is, doesn't know a world without Instagram, the one before Facebook, one before that, iPhone, and the one before that, mobile web, and, then there's my generation that remembers the AOL dial-up internet. We just adapt and we adjust and we learn from these platforms. You don't look at a kid today and say, oh, why would you use Snapchat or Instagram? Because they look at you like they're ridiculous. And so with this emergence of baby wearables, where they're actually stopping SIDS, or they're figuring out if a child is going to be sick before they get contagious and go into school, like very soon you're going to look like you're not necessarily a good parent if you haven't connected your baby or your child, which is going to create this whole generation of people that only know leveraging or seeing their data. One of the things that I think has been really interesting is we've been talking to large scale CPG companies that have cookies and soda, and how this is going to kind of impact buying decisions that impact obesity. It's one thing for your mother to tell you, hey, don't give Marco sugar, he's going to go crazy, or it's going to be bad for him. It's another thing to actually be confronted with the data, and that will impact buying decisions on like a massive scale. So I think that we're going to see the writing of this over the next 3 to 5 years. In fact, we're engaged with a lot of big CPGs because they're petrified of this, and they all missed mobile, and so now they don't want to miss this next iteration. When it comes to leveraging this type of data, should be, how should we treat privacy, particularly around children? Because even one of our startups is a toothbrush that you brush the teeth, and there's a mobile gaming app, and you get rid of squids, and then it sends the data to the parents and also can send the data to the dentist. What's the principle behind that? How do we leverage that for good and not for bad, or should we not use it at all, specific when it comes in terms of medical health? I'd love to get your guys' feedback on that.
Philosophically, we believe that the user should always be in control of their data. But the way the world is going, already we give up a lot of data if there is value in exchange, right? Think about how much data we give up on Facebook and Google. Why? Because there's some value or perceived value in exchange. And I think with each generation, they're just going to be less and less sensitive to that, especially if there's that value in exchange. For example, volunteering to have your driving habits monitored so that you can qualify for lower auto insurance, right? But speaking to the trend that you're talking about, we think wearables will be most successful when they are completely ambient, when they are truly, the technology is so invisible you don't even know it's there. right? So whether it's in your clothes or, you know, in your earrings or in the baby blanket or in the room, that's the way, that's where the world is heading. And there's a lot of good that can be done with that data, but ultimately the user should be in control.
So in the kids' case, I think obviously the thing you have to be aware of is that the user and the customer are two different people. So the customer is really the parent and the user is the kid. And I remember growing up, the number of times my parents said to me, "Marco, sit up straight," you know, and it reminds me of what Monisha's technology does, and it does it in a much kinder way. Maybe that's just the nature of my upbringing. But I think in that case, there have been some examples of technology that improves behavior for kids tying directly to their motivation. You know, GeoPals does that with their activity monitor. If you don't get enough exercise, you don't get credits basically to spend time gaming, you know, so you don't get to spend time on the tablet playing Flappy Birds or whatever you'd like. So linking the user experience to the user motivation is really important, but understanding who the customer is, because we focus a lot on adult wearables and adult technology where the user and the customer can be the same person. With kids, it's very different.
So I think it's an opportunity for us to really flip things, because today, you're right, I don't think we make the connection between getting free access to Facebook and how they monetize all of our data. But let's flip that equation around and say, well, I've got all these sensors now, and I'm collecting all of this data about myself. Is there a way for me to monetize that? And if I want to sell my data, then why can't I? So I think there's potential for a future where we can monetize data that way. But I want to just jump to something else, which, as Monisha said, you know, this stuff all has to become ambient. And even Marco, you said, you know, it's got to be integrated, because today, if you think about it, if you're a Silicon Valley early adopter of all of these technologies, you know, I'm into road biking, and I'll tell you this, you know, story where the group that I ride with, a bunch of engineers, you know, we stopped. And we got to go back to where we started. Why? Well, because my sensors weren't picking up the ride, and if I don't, you know, track my ride and get it uploaded to Strava, which I pay, you know, $59 or $69 a year for, talk about sharing my data, then the ride didn't happen, right? Okay, so then you get home and you've got hue lights in your house, but you need to get your smartphone to turn the lights on. You know, it's just, all of this stuff is very awkward today, and it's going to have to become very, very streamlined into our whole life, and that's the next hurdle that we have to get over.
I love it. I always have great questions for you guys. So you know, I think one of the things that I really, you know, appreciate about the ecosystem that we're in right now is I think you know, a lot of wearables is just mobile in transition. And it's like this disappearance of these, you know, bricks into form factors that disappear into something else. Maybe it's incitables, maybe it's, you know, I beg to get around it. I think one of the things that makes me nervous, and we bring it up, you know, the obesity epidemic a lot of times is part of like you know, it's the poor of us. And there's an equability play, you know, where we have, I think, I was very much against the $1,500 price point that Google put out, specifically because it left a message about equitability saying you can't afford this, and hit a really strong line. And I think technology has always been initially for rich people. Even Stained Glass Labs, which is what we were when we initially started, was all about how these monks took this really expensive technology and used it to teach stories to everyone else. And so, you know, with that being said, I mean, how do we prepare for a world where humans are going to be augmented all the way down to the medical side, and do it in a way where we don't leave people who don't have the same incomes as us behind? Like how do we position and make sure that doesn't happen? Because I think that needs to be talked about right now. Otherwise, it won't fit in our business models.
No, but it's just about early adoption and then mass market availability, right? So today, if you can afford it, you can drive a high-performance electric car. At some point in time, that technology will make its way down, right? Just think of smartphones. It used to be that only at the high end of the market, if you could afford the smartphone, could you have a smartphone? And now you've got smartphones at every price point. There is no such thing as anything that's not a smartphone. So I think it's about the broad market availability of technology.
All right, great. Okay, so we got time for me to ask one more question, then we'll get questions from the audience. Where do you see the next 6 to 9 months for wearable technology? Like, what do you see is on the more recent horizon, particularly in how it relates specifically to your product or what you guys are most keenly interested in on the wearable front?
So from our perspective, I see this going global. I think we're going to all be wearing technology in that time frame. Just recently, we announced a few new products. We announced Mika, which is a collaboration with Opening Ceremony in New York. We launched it at New York Fashion Week, so we're doing things that are really part of the fashion industry, addressing sort of the aesthetic opportunity. We also announced heart rate sensing headphones with SMS audio, so you can have biosensing accessories that don't require a battery or a recharge. You just plug them into your smartphone to listen to music, and you get that additional functionality forever. Basis just announced a second generation product, Peak, which is an upgrade on the first generation, heart rate sensing 24/7, including during exercise with 5-day battery life. So all of a sudden you have full contextual cardiovascular monitoring for your whole life. I think that's really exciting too. So all these different sort of approaches coming to market will mean that there's something for everyone. I think the challenge for us here on stage that are building this technology, and for those in the audience doing the same, is to make sure that we create things for every market. This question about how do we make sure that people aren't left behind is really a question of missed opportunity. There are markets that smartphones still aren't addressing. Certainly that's even more true for wearables. So I think this is a really exciting time to address those markets, and we've seen some companies today that are addressing some of those. So in the 6 to 9 months, I think we see a lot more relevance in the industry, which means the adoption curve is exponential.
My prediction is that we'll see a lot more integration of data. I think one of the missed opportunities of today is a lot of our data live in silos. And, maybe Lumo has our own insights based on data we're collecting, but imagine our ability to have meta insights as we integrate that data and combine that data from other sources. And so I think to the extent that we have more and more collaboration, a lot more integration, and a lot more sharing of data, again, when the user gives us permission, I think that's when we're going to start to see some real innovation.
I'm curious if we're going to see strictly mobile become strictly mobile and wearable.
I don't know. The whole thing, it's a completely anachronistic, slogan that we have, which is called strictly mobile, right? For us, because our view is that there is only mobile. Okay, so 6 to 9 months. So Apple Watch will be out in about 5 months. And I think that's where we will get a view on whether there's really a market for smartwatches and that sort of wearable. So I think that's what I'm looking at from a prediction standpoint in the next little while. Because it's still not, don't take it the wrong way. I think these are still science projects. They've not gone to mass market appeal yet. They're still very much first world technologies, right? They don't solve or have not yet transcended to truly global solutions that are going to make an impact, in third world. I mean, smartphone technology for sure, but we have to see if we can extend wearables in this whole broad definition.
That's great. All right, so we've got some time from the audience to finally poke around and have some questions at us. This gentleman was the first one that I saw. He's quick on the draw. Right here.
Thank you. Peter Beardmore from Kaspersky Lab. Very interested in the security and privacy discussion. Has anybody in the mHealth intelligentsia discussed or determined the line of demarcation for data where that data becomes regulated? That's the first question. The second question is regarding Monisha's question about believing that the consumer should be able to control their data. Who believes that that's even plausible right now? And when do we believe that there'll be a tipping point where that is absolutely demanded by the consumer?
So I'll take the first one and give you guys a chance to think about the second one. We always approach data security in a way of imagining as if the data was regulated from a user privacy perspective, so we treat it with that level of sincerity. We're that serious about, because a lot of the business is about trust. We're collecting information that's about your person, if you like, your health and fitness. And so we respect it at that level, regardless of where the line is. From a regulatory perspective, the guidelines are pretty clear around HIPAA and where that hits the physician, as well as from an FDA perspective, where you're providing treatment, diagnosis, or cure. So I think the language there is pretty well demarcated. But I think from a practical perspective, you have to be treating the data as regulated from the outset, just to have that level of sincerity that you're respecting the user's trust and allowing them to opt in, but assuming they've opted out.
So the last part of your question, I'll take that. I think there will be a point in time, it's not in the next few years, it's longer term, where there's the potential for an evolution of a data marketplace that the consumer controls. That's one of the bets, I think that we're pretty interested in making, but it's a longer term time frame.
Just to kind of I have a little bit of a different perspective. I think, instead of this fear of data, or I call it data abstinence training, where we're telling entrepreneurs, be really careful with this. I mean, I'm not saying to not be careful, but I think we should focus more of the conversation on whether or not we should have it, and just realize that we're going to have it, we're going to leverage it, and create things more around data responsibility. And when it comes to security and privacy, I think, data in general is going to be 99.99% secure. The only way to make sure that you get hacked is to say that you're really secure. And so no matter what safeguards that we put up, there's a 100% probability that it's not going to be enough safety or security protocols. So I caution us more on driving the innovation side and looking at data as a transaction between the end user that generates it and the services that I'm providing, and I make damn sure that the services I provide enhance that user's ability. And I think that should be the discussions that we have, and not necessarily whether or not we should have it, because it's a not unique situation. We will have it, we will always have it, we will always use it, and it will always inevitably be at risk of being hacked. I think if we make arguments around it, I think that we open ourselves up to being irresponsible and deluding ourselves into thinking that we can actually hold on to it and keep it secure. I would rather focus on creating an ethos around it of, it's here, let's leverage it only for good things, and not just to ding people on insurance premiums or stop them from getting good jobs. That's my nickel on it. Any other questions? Go ahead. It's you, partner. You got.
So, can I ask what you think the impact of the Apple Watch will be? Do you think it will be a flop or a success, or neither, or a bit of both? And secondly, do you think that there'll be a consolidation of wearables around one or two devices, rather, or do you think that we might have, earrings, bracelets, nose rings, penis rings?
I think a commercial success. I think the Apple Watch will definitely be commercially successful because there's so much interest and there's going to be so much marketing dollars behind it. And what you'll see is Apple will outspend the top 5 competitors 10-1 combined, and will drive sales for Monisha's product, which is great that she's in Apple stores. It will definitely drive sales for all the products that Basis is putting out on the market, because it will drive consumer interest, followed by extreme significant disappointment on the end of the users, because all the promises that they've been given won't actually happen or be there. But then the apps will kind of catch up, and you'll see a larger disruption on the mobile app space, because people won't be able, just like they couldn't go from mobile web to iPhone application, they won't be able to do the same thing, because you won't decouple your brain and realize that this is a totally different function and form factor and way to interact with your users. And so just like 80% or 95% of the mobile web successful applications are gone and didn't port over, most of that business will go away in the same sense, because you're going to have to be able to unify that whole experience, and it's extremely difficult. In regards to multiple different devices, I have socks, I have pants, I have underwear and shirts and glasses, and they are all different brands, and they all basically serve the same functionality for me, but I just leverage and use them differently because they have different use case niche needs that support me as an overall human being. And so I think that there will be consolidation, of course. People will pretend like it's a great one, but in the end, we'll have all this different diversity of tech all around it, more likely driven by the tens of millions of dollars that Apple's going to spend in the last half of next year.
I think we're here in a day that's entitled Innovation Day. You know, I think for me, Apple and Google and Facebook and big tech companies do a great job of giving you plenty of reasons to wait and see what they do. In this case, Apple has given you just enough to get you sort of interested in talking about it, and maybe even enough to wait and see if they define the market for you. I think the key to innovation here is to not wait and see what they do. Be ready to react if it's a device or an innovation that impacts your world, but don't let it slow up what you're doing. You know, the reality is, especially in the Apple case, we know so little about that device and their strategy long term. I think if we're letting that guide our behavior today, we're really just reactionary to Apple, you know, and guess what? There'll be another announcement next September, October, and the year after, and you can choose how long you'd like to wait and see what Apple does. So I think my guidance would be, it'll certainly have an impact. They'll sell a lot of units, there'll be a lot of marketing dollars, but I'm not going to let it change my life in the short term. There's a lot of time between now and even when the first generation launches. You know, and we've seen, even with things like the iPhone, the first generation is very different to what the product ends up being successful for. So don't let us stop our innovation because we're waiting to see what Apple does.
All right. Anyone else?
Yeah, we're excited for the Apple Watch to come out, and we'll absolutely build on it. And our form factor has to go on the torso of the body in order to track posture and biomechanics. And so it's one that can't be replaced by a phone. And what the Apple Watch will do is it gives us yet another display, one that's ubiquitous and ambient, to be able to transmit the data. So rather than having to open up your app on your smartphone or use our desktop app, it'll just be on your wrist. And then also, it will allow for the freeing of the data that I talked about before, where we'll see a lot more integration of data across different devices and different apps. So we think it's going to be a great thing.
Well, thank you guys so much. I always enjoy spending time with you guys on stage or anywhere. I appreciate you guys giving time. Audience, I appreciate your time. Thank you guys for listening and enduring a little bit of an offset on the wearable side with mobile. Namaste.
Thank you.